remote. We're about to go live here, I think, here in a second. I guess I could wait to go over our list of attendees. Thank you. Okay, we're live on the CARES Act Steering Committee meeting. Today is Thursday, October 28th, and we have attendees here in the Governor's Office conference room as well as live on Zoom. So I'm going over the list of attendees. We have here, I'm Elizabeth Smith, the chairman of the steering committee. Here also with us in the room is Secretary Larry Walther, Bill Gossage. We have Representative Lane Jean and Secretary Cindy Gillespie and Chief Hankins here for Secretary Jamie Cook from DPS. Thank you. And then the other committee members that are here remotely, Secretary Mike Preston, I believe, yes, Alex Johnson is filling in for Secretary Amy Fetcher. We have Gina on for Secretary Johnny Key. And let's see who else. Oh, we also have Jonathan from DIS. Here we go. Hi, there's Representative Michelle Gray. Thank you. And I have my Zoom screen over here so I can see everybody's face. Senator Irvin, have you joined us? And we're waiting on, is that Senator Irvin? Are you there?
Hey, this is Dr. Bledsoe, Greg Bledsoe. I'm here.
Oh, great. I thought I saw your picture. Good. There you are, Dr. Bledsoe. Thank you very much. Representative Allen, have you joined us? Senator Wallace? Senator Elliott? So we're still missing 4 of our legislators.
Give me off a piece of Larry's notebook. He's kind of stingy.
So I'll just go through some housekeeping while we wait for the others to call in. I do believe that they will attend. I didn't have anybody say they weren't going to make it. So I just want to make sure everyone has seen the meeting items for the meeting. We have an agenda that was revised, so make sure you have the agenda revised. And then we have items, minutes, and the fund balance spreadsheet. It was dated October 26th, and we do have a new fund balance spreadsheet that I've not circulated it today because there's very minor change to that, and we can go over that as we get into the meeting. And then we had a request from Department of Human Services under Exhibit 3A, and a request from Department of Commerce, and that's Exhibit 3B. And those are requests to reallocate funding that they currently have. And then a request for funding from TSS, Department of Information Services, and that's Exhibit 4A. So let's see if we had anybody else join us while we were going through that. I don't think so. So do you have any recommendations? Should we give it a minute for our 4 or 3? Just go ahead. Okay, thank you.
At the proper time, I'll make a motion to approve the minutes.
Okay, thank you. I think this would be the proper time, Representative Jean. Thank you for the motion to approve the minutes. Has everyone had an opportunity to review the minutes? Exhibit 1A. Any suggestions, corrections? A second to the motion to approve? Second by Secretary Walther. All those in favor?
Aye.
Any opposed? Okay, thank you. Thank you, Representative Jean. The minutes have been approved. We'll move on to our next item, and that is the review of the remaining fund balance. And DF&A can give us a report on that. And you'll see that on your spreadsheet, Exhibit 2A. And remember, this is the one from October 26th. The only change on ours on that one was related to the CTEC funding.
Okay. The remaining balance as of 10/28/21 is $167,494.27. Based on your research over the last few days. We have another $702,013 that will be coming back from the Department of Commerce. That would add up to available for other uses, $869,507. So when we get to the request, that would, we have $869,507 available to distribute to other places.
Thank you. We do have an additional amount coming back from Department of Health. They've indicated that there's $200,000 left from the Northwest Council amount from Marshallese and Latinx population. If Department of Health wanted to speak to that, that was the information they provided to me.
Okay, I didn't see that. Is
Should
that
be-
the only other one?
That is the only other amount that we're receiving back right now.
So we'd have $1,069,500.
Thank you. Very good. Does anybody have any questions related to our fund balance spreadsheet?
Any
I
questions?
see somebody's trying to raise, is somebody trying to raise their hand? No, we're good. Sorry, I can't read my Zoom very well. Okay, I think we're good. Thank
Thank
you.
you.
Thank you very much. So the agenda shows the review that I did with the various departments and their requests, explaining which requests still have money that is left in their account or in their balance, but they haven't spent it yet. And so that was one thing I wanted to make sure of, is that they are still planning and able to utilize the funding that we have allocated to them.
Okay.
Okay, so our next is
I've got one question.
Yes,
Kind of get my
Representative
mind.
Jean, go ahead.
We had, what, $1.25 billion to start out,
Yes.
and this is what's being turned back. Has everything been spent, or we still got stuff that is gonna be spent up until December 31st?
We have, okay, I want to make sure I understand your question. So we have allocated the $1.25 billion. And what we're looking at now are dollars that have been returned, as well as money we've earned in interest.
But everything we've allocated outside this $1,069,000, has it been spent, or is it still to be spent through
So-
December 31st?
That's right. So that's exactly right.
These are the remaining balance.
Okay, all right.
So there are some of these, and that's what we have on our agenda, and this is also posted on the website, so anyone can see it. But for example, the PBS project for broadcast, they are still working on paying invoices for the items that are coming in that that are being installed. And the same with Department of Commerce for IT modernization, Rural Connect project, and the unemployment call center. They still have funds that they are currently utilizing.
So, is there any more funds that are gonna come back?
Well,
I mean, we're gonna be down against the clock.
we are. And so that's what the last item on our agenda today is for us to determine a deadline to discuss, to have the department's a drop-dead deadline for when any department that hasn't spent money, they would have it in the next to the last column on the spreadsheet.
We'll talk to you about that one. We've got some ideas on it.
Okay.
Yes, so we have some ideas. There's also potential for funding to come through from FEMA, but we don't know whether that's actually going to happen or not. So we'll talk about that when we get there. Okay?
And Paul Oakland's on the line. He's been working.
Oh, good. Okay, thank you.
At least he's supposed to be on the line.
I see him. I think I see him. Okay, good. So we'll go on to item number 3, and this is Department of Human Services. They do have funding that's remaining, but they have a request to utilize those funds remaining, and that's outlined here on our agenda. There is a attachment, I think it's 3A, explaining their request, and I've got Cindy Gillespie here to make the request.
Thank you.
Go ahead.
As you can see, we do have some funds that have not been spent yet, and will not be towards these purposes. In most cases, these are funds remaining from some of the programs we ran where either a hospital or another medical entity did not draw their allocation, or in some cases, overdrew and has returned. So we do have a little bit of money remaining, and we are here to see if you would be willing to let us reallocate it towards some of the needs we have at the Arkansas State Hospital because of the heavy COVID impact at that hospital. And I've asked Jay Hill, who oversees that area, to come just to talk about how these funds would be spent. At the rate he is spending money, I can assure you he would have this out the door for the cost that we're incurring there. Director Hill, would you like to take it?
With that introduction, and thank you, and I thank the committee for allowing me to come today for just for the consideration. The hospital, as has every healthcare provider, has just been slammed through COVID. They do outstanding work. They've done all they can do. We're continuing to do all we can do, but we truly are up against a very difficult situation with our budget, with our spend. And a couple of areas that I had talked with the Secretary about where we really, truly could use the help of particular interest is our nursing services contract line and in our general operations. We utilize agency nurses to supplement vacancies, shortages, nurses that are off. It truly, the workforce is difficult at best to say right now. All of our agencies are struggling to hire. And so the utilization of these nursing agencies allows us to take care of our patients. And in a lot of healthcare industry settings, admissions very often follows staffing shortages. For instance, at a nursing home that we operate in our division, our census levels, we have the ability to allow that to fluctuate depending upon what our staffing levels are. However, at the state hospital, because we primarily serve forensic population today, we stay at 100%, if not greater capacity every day. Yet our staffing is suffering due to the inability to hire in the nursing industry. And so these contract agencies are vital for us to bring in the staff that we need to maintain our ratios and to maintain a safe environment among those mentally ill patients that we have at the state hospital. The rate has gone up for nurses. Hiring healthcare staff is a premium today. It truly has gone up exponentially. And so the ability to be able to supplement the nursing services contract line with these funds, as well as the operational costs, just to ship materials in goes up. Medical supplies has gone up. My environmental services costs have gone up about 28%. Our utility costs are going up about 25%. Just in general, the operational lines across the board have all increased. And the interesting thing about the hospital versus a private hospital is because we are an institution of mental disease, what we call an IMD, we do not have the ability to bill for services as a private industry hospital does. And so our revenue streams are extremely limited because of that exclusion, because of the IMD exclusion. And the vast majority, 90% or greater of our patients don't qualify for reimbursement services, don't qualify for Medicaid reimbursements. And so where we have really tightened our belts, we have found ways to shift our general revenues and what revenues we do bring in to the hospital. We are in a position where being able to sustain the rate of spend that we have, particularly in our operations line and our nursing services line, it looks rather ominous. And so this was an opportunity to come in and be very blunt, be very honest today, and speak with you about the opportunity to hopefully offset these costs with available CARES Act funding.
Thank you. Does Secretary Walter have a question?
Have you talked to Paul Lothian, or are these expenses been covered by CARES in the past, and this would just be the continuation of something we've already done? I'm just thinking about the eligibility as it relates to the type of expenses you're related to CARES.
And no, Secretary, I've not talked to Mr. Lothian.
I'll say it, Mark White, I have talked to Mr. Lothian on a brief extent. And I would say just what we're looking at, these are similar expenses we have been covered for other healthcare facilities through CARES funding.
All right, I think we need to make a check to assure ourselves that they are.
We'll verify that.
All right, thank you.
Do we have any other questions, for, is there a question remotely from Zoom? May just be somebody's background noise. Are there any questions for the Department of Human Services or the State Health Department? I'm sorry, got distracted. ASH. Okay. Is there a motion of potential?
I make a motion to approve. This is Mike Preston.
Thank you, Secretary Preston.
Second.
And a second by Representative Jean. All those in favor?
Aye.
Thank you. Any opposed? Thank you. Your motion has passed. And we will double check as Secretary Walther has requested. I do believe this is in line with the same items that y'all have issued before. Thank you very much. Okay, moving on, Secretary Preston. We have, and I know Dr. Childers is on. I see her on as well. A request to reallocate support funding from the National Guard allocation back to UI administration. So if you'd like to explain that, or if you'd like to have Dr. Childers.
Sure, I'll jump in and be quick, and appreciate you, Madam Chair, getting us together and this request. So as everyone, just as a refresher, $2.2 million was appropriated and approved and utilized for support to our UI administration to alleviate the backlog and kind of help with the long lines that we're seeing related to the pandemic unemployment assistance. We brought in the National Guard, and these funds were used to support them during that time. We transitioned from the National Guard to a staffing agency. This carried us about 3 months to get us caught up on the backlog and everything we needed to. Of that 2.2 million that was appropriated, there's approximately $923,887.69 left that we would just like to reauthorize to go on to for our continuing UI administration support. As we brought everything back in-house, we're no longer utilizing the Guard or the staffing services, but we still are trying to work through the backlog and have additional staff and IT needs that are trying to pull us through this. So we will have these funds expended by the end of the year and make sure we meet the deadlines associated with it. So again, it's just a reallocation of those funds from the Guard and the staffing agency back into our UI admin that is shorted as a result of the pandemic. Happy to answer any questions.
Thank you. Does anyone have any questions? No. I don't see any questions. Is there a motion?
I'll make the motion.
Secretary Walther, motion to approve. Is there a second?
I'll second.
Thank you, Secretary Gillespie. All those in favor?
Aye.
Thank you. Any opposed? All right. Thank you. Your motion has passed. Thank you very much. And thank you, Secretary Preston. The next item we have is a request for funding. So we did speak about, Secretary Walther mentioned the $1,069,500 that is available for reallocation or allocation. And we have a request from the Department of Transformation and Shared Services. And here on behalf of Secretary Fetcher is Alex Johnson and Director Askins. So if you guys would like to speak, they're on Zoom.
Oh.
They're not in the room with us.
Hey, this is Alex Johnston. I am here for Secretary Fetcher. We're going to step out on this vote just since it's our department, but I'm going to toss it over to Jonathan and let him go through the proposal.
Sure. Thank you, Alex. So essentially the conversation is, as we're going through data center modernization, we have some capability to expand our project some. We can do that relatively easy through, since we're purchasing software, we're not talking about large lead times from a hardware perspective. So the fund transfer and the product transfer can happen within days. We are talking about some laptops here to bring some laptops up to speed for the data center as well. So our request was fairly straightforward to Secretary Smith was, if there are leftover dollars, I have the capacity to spend those very quickly and make sure that, you know, we're not having to return dollars. And these are dollars that can go toward our data center modernization project. So that's, in a nutshell, that's our request. Our request is if there's dollars left over, I've got capacity to spend those quickly.
Thank you. What questions? Yes, Secretary Walter, go ahead.
Just want to make sure you do have appropriation available to spend the money also, right?
I'm sorry, appropriation available?
Yes, appropriation available at TSS to spend that money in those areas.
Yes, sir. I'm assuming you do.
We can work with you to make sure that that is the case.
I believe Ann looked at this, and
Okay.
but I believe we're good there.
All right, thank you.
And also, I wanted to make sure you're aware that your request is $1,176,000, but the available amount right now is $1,069,500. So we're be short about $106,000
I got
for
a
your
question.
total. Okay, Representative Dean.
I'm looking at $650,000 for 20 workstations and laptops. What kind of workstations are we talking about that cost?
That number, that's got to be a typo. That number is 200 workstations. So it would be 200 workstations, 200 laptops, along with the monitors and along with the docking stations on that.
All right.
So
What consists of a workstation?
Well, a workstation would be your computer at your desktop or your laptop, along with your monitor and your docking station.
You're not talking about additional space?
No,
You're
sir.
just talking about
No, sir.
Okay.
No, sir. I'm not.
Yes, Secretary Gillespie has a question. Go ahead.
Not really a question, it's just more of a comment. Because of some briefings I've been sitting through over the last few weeks, that Jonathan and others have been holding around cybersecurity and some of the steps we're taking as a state, with everything going on right now around cyber attacks. I guess I just want to note that the software they're looking to do is incredibly important. I mean, the cyber world right now is an incredibly scary place. So just, this would enhance the security in the state a good bit to be able to move forward.
Thank you.
If we were not virtual, I'd probably hug you, Secretary. So thank you.
See, briefing me does have benefits. It can be annoying with my questions, but.
Are there any other questions? So how are we, if we are to have a motion, I guess the question is, I imagine Secretary Gillespie might be wanting to make a motion, but before we do that, I guess my concern is we have the request is for $1,176,000, but we only have $1,069,500. If we allocate the $1,069,500, then would TSS pick up the leftover $106,000, or what do we do with it? How do we do that? I can't authorize money that we don't have.
I'll try to answer that, and Alex and Ann can add to that. But that is correct. TSS would pick up, TSS and DIS would pick up the delta that is not covered through the CARES Act.
Okay, is that appropriate, Steve?
Yeah, and if we get more available, we would have already approved it to go over there.
Okay, and that could potentially be the motion, and that could be what's approved by the committee, is that we would do up to the amount that they've requested if we have that. So, any questions about that, or do we have a motion?
I'll make a motion, so if I can.
Okay, go ahead.
The way you said it. I would make a motion that we would approve up to the amount that they have requested of $1,176,000 in return funds being made available to TSS for the purposes outlined here to enhance cybersecurity through extension of software subscriptions and the workspace updates.
Thank you. Is there a second?
Secretary Smith. Secretary Smith.
Thank you.
Can I interject?
Yes, it's a question. Oh, yes, go ahead, Jonathan.
I'm sorry. So I'm not, the number that you have on the minutes does not match the number that's on our request. And that's my fault. That was my fault. So when I sent you the first notes, I was cutting and pasting from a spreadsheet, and I pasted the wrong line on the very first email I sent you. The actual number is more like 1.3 with all of the laptops included in there.
1,347,000.
Oh,
Yes, sir.
okay.
All right. Then I would amend my motion to 1,347,000. And it, as you said earlier, is a motion to provide up to that amount as funds are returned.
Does everyone understand? Does anybody have any questions? Okay, and is there a second? Do you stand with your second, Secretary Walter? Or are you calculating? Thank you. I think he's calculating for us. Okay, if there's is there no further discussion, no further questions, I'll call for a vote. All those in favor?
Aye.
Aye.
Any opposed? Very good. Thank you. Congratulations, Director Atkins. I know Secretary Fetcher will be happy when she gets off the airplane. Okay, number 5, the last item on our agenda is this discussion about making a determination of a drop-dead deadline for where we have the ability to sweep back the funds that we believe will not be used so that we can actually use them for purposes that are necessary related to COVID. We also have an indication, and I think Holothian is on the line if we need to get some more information from him, but way back over a year ago, if y'all remember, March, April of 2020, we talked about requesting reimbursement from FEMA for the PPE that we are utilizing for the state, we have utilized for the state. And they've gone through the process. I think there have been a number of departments involved in making that request. And so now we're waiting to hear back from FEMA. If we receive that funding before the end of December, that will come back into the CARES Act pool. So could offset expenses that we have. Potentially it won't come until January, at which point it won't really help us with the CARES Act pool. That'll just be money returned to the state. I assume that's how that works. So what we would like to do is we have already had a number of departments speaking with DFNA about potential uses of funds. And what we'd like to do is look at that in the next few weeks and then have another meeting where we would schedule these ideas of requests, these proposals as a contingency for if we have additional funding back, what we're going to do with that. Is that clear? And is that what your thoughts were, Secretary Walter?
Right. I've been visiting with Mr. Lothian about this afternoon, and he's got some ideas. We do need to do some research. If we can find expenses that have already been incurred and paid that we can reimburse, those would be fast moving, and so we could turn that around rather quickly. But buying new things would be more difficult as we get into the latter part of this year, say, really starting on the 1st of December, maybe the 10th of December. I'd like to start shutting the door sometime in that time, or like maybe the 10th of December. If they haven't spent the money, and can't assure us that the money will be spent, and it was with legitimate reasons, right, and documented reasons, I think we need to start finding ways to move it to areas where we can legitimately provide reimbursement for expenses incurred corrections and others, maybe in
Thank you.
VHS and other places like that.
Thank you.
Paul, do you have anything else to add to that?
No, sir, you covered it. It's just, it's going through and getting contingency, set up for stuff like overtime reimbursement or additional PPE and stuff like that. We think the money's gonna come back, we hope, within the next 30 days. You know, it'll first land at Adam, and then Adam will have to go through our documentation and approve that, and then get the money to us. So it'll be a really fast-paced review by them, I hope, to give us the maximum amount of time that we can have to make these decisions. But we want to have some things to talk about very soon, and get our ideas together. Need to talk to CTEC and see what they've done in other places, and try to get all the options on the table that we can.
What Paul's referring to is the possibility of a return of as much as $60 million that we petitioned FEMA for, expenses that, let's say, that have been incurred that we feel like need to be, that we've spent, that we feel like could be covered by FEMA dollars. And that's in addition to the money that could be returned from the CARES, from individual agencies within the state that would possibly be coming back also. There's 48, I think, hold on.
Yeah, so if you want me to go through this,
There's $48 million right now that has been, that has been allocated to the agencies that actually hasn't been spent.
That's
that
correct.
They're saying they can spend by the end of the year.
That's correct.
And if they, listen, there's a possibility that some of that money won't be spent,
That's right.
right? One would think. And if that's the case, we also want to be able to find ways to redistribute that money to, where we can move it quickly and do the reimbursement or whatever, or, you know, the software purchases and things like that. So it's more than just this money. It's also possibility of up to $60 million for FEMA.
Right. Yes, Secretary Gillespie, go ahead.
So, Paul will reach out to us to talk through some of the types of previously incurred expenses that could now potentially be on the table. With the facilities we operate, we have a lot of COVID-related overtime, obviously, and things like that we've spent for the last 18 months, I guess. So.
Paul, did you hear her?
I think so, yes. Anything like that would be something we didn't put on the table. Of course, you gotta have documentation, and you have to be able to certify that it wasn't eligible to be paid by any other funding source. But that's exactly what we'll be looking at: overtime at corrections, overtime at the state police. We've got a feeler out to them. So anything that y'all have would also be available for reimbursement.
Okay.
We're gonna have to have something we can move on very quickly. And we're gonna have to be ready to do that as late as the 29th of December.
All right. Any other thoughts or discussion regarding this issue?
Yes.
Okay, I would like to ask for us to make a determination as to a deadline. So what I've done, and you'll see it on the agenda, where I went through to each of these different departments that has allocated funding that they have not spent. And I mentioned PBS, we have Transportation Insured Services, we have DIS here. They were initially awarded 34 million, and they still have 24 million left, but we're assured that they will utilize that. They're waiting for items to arrive so they can make those payments. And I think that's the same with, we've even got a note from Department of Public Safety today regarding the $699,000. So I think each of the departments that have funding are looking very carefully at every dollar that they have to make sure they allocate that. So I guess what we need to do is make a decision on what would be that deadline. Is it December 10th? Is it December 1st? What do y'all feel is the best?
I would say it should not be any later than December the 10th.
Okay.
You agree with that, Paul? Logan?
Do you agree? He may be on mute.
He's talking, but
Logan, I can't hear you.
they're on mute.
Bit louder.
Is his mic
He gave you the okay sign.
Okay, thank you. Okay, thank you. So what's the will of the committee?
I make a motion that we set that December the 10th is the date by which we would expect final spending of the money, and if not, then we would begin
Okay, and potentially begin to claw it back.
Yeah,
And potentially if we had assurances where they had an invoice out or an item on
yeah.
order and that type of thing, we would allow that. But if we're still trying to figure out how to spend it
And who to spend it with.
and who to spend it, well, we should know who they're gonna
Right,
spend it with.
you know,
Yes, then, that way we can reallocate.
so
All right, so your motion?
my motion would be to establish December the 10th as the cutoff date for the spending of the money.
Is
And
there,
after which we will claw that money back for redistribution wherever possible. And this is not part of the motion, but obviously we'll work with the agencies. And if there are unique circumstances where that money can be spent for the purposes that were initially determined, we will make that happen. Okay? Anybody have any trouble with that?
it's a good motion.
Does everything have to be spent by the 31st or spending it? Spent.
Right? That's what I understand.
Okay.
There's,
Is there, oh, is he trying to say something?
Paul, do you have something to say?
Can you hear me now?
Yes.
Great, thank you. You know, early on, there was the comment that the money had to be obligated and you had 45 days to, this was the first, it was going to be at the end of the first year. You had 45 days then to pay the obligation. I need to make sure that that carried over, but it's my understanding that it did, which means that the goods and services have to be rendered to the state agency at that, by that date, an invoice received, and then you can pay it subsequent to that. But you have to have the money obligated. You can't say, I want to use it to pay for something I have on order, but it's not gotten here yet. That's not an obligation. Obligation is you receive the goods and services. Yeah.
Okay, and
thank
if,
you, Paul.
thank you. So the goods and services need to be here by December 31st. And then if we make the payment after that, then.
Okay.
Within 45 days.
And I think that's sort of the way it works at the end of the fiscal year. You have to have the product on your shelf or in your office, but you can pay it afterward in that 45-day period, something similar to that.
Okay.
That's fairly common on federal grants.
Right.
Very
Thank you,
good,
Paul.
very good. Okay, so your motion, is that December 10th would be our cutoff date for funds, to determine clawback for funds for redistribution when possible. Okay? And we need a second. Secretary Gillespie, thank you very much. Any discussion or questions on the motion? Okay, all those in favor say aye.
Aye.
Thank you. Any opposed? Okay, thank you. The motion is passed. Well, I appreciate everybody's hard work and our fast meeting today. We will keep an eye on things and we will reconvene as needed. And I look forward to seeing you again. Thank you.
Thank you, Elizabeth.
Thank you, Elizabeth, Secretary.
Thank you.